Now, Doc, you've performed a study of fungal infections in mosques in Durban. Could you please tell us a bit about this study?
Yes, in fact, I did the study with two colleagues of mine. One was Professor Abu Bakr and the other one was Dr. A.K. Peer. And we did this in 10 mosques in the Durban area. So we went physically to those mosques and rounded up all the musallis that were there for Isha Salah.
Right.
And we examined their feet.
Okay.
We looked for evidence of fungal infection.
Yeah.
We looked for evidence of nail infection and fungal infection between the toes. And if they had anything that resembled fungal infection, we took a skin scrape and a nail clipping and sent it off to the laboratory.
Okay.
And in the laboratory, they grew the fungus and cultured it, and they gave us a report to say that this person had fungal infection and that person didn't. And then we went to King Edward Hospital's office workers. And these are, of course, people who are not reading Salah. They are non-Muslim. And they are in the sort of also wearing shoes all the time and so on. But we examined them and we made a comparison between the Muslim population and those that were not engaged in Salah. And we found that our community had double the infection rate compared to those that are not engaged in, or let's say not in mosques, for example. So naturally, this is not saying that wuzu is a problem or Salah is a problem.
Yeah.
We are told for every disease there's a cure. So we must go out and look for the cure.
Absolutely.
And the fact that for every disease there's a cure, it's not denying the fact that there is disease. So we need to look for the disease and we need to find the cure. And for that reason, we made certain recommendations at the time.
Yeah.
That is to put paper toweling in mosques, and that a large number of mosques adopted this.
Have followed through that, yes.
We recommended that we use special detergents to wash the wuzu khana areas and to wash the carpets and shampoo the carpets. And that actually resulted in a huge decrease in fungal infection in the community.
Great.
Massive decline. And that was a campaign that we did throughout the mosques in many parts of the country. And that paid great dividends. And I think at this time we should actually run another campaign to educate our musallis that this is not an attack on cleanliness. Of course, wuzu is a sort of physical hygienic process.
Right.
But if you look, for example, at mosques in the Middle East, the wuzu khana is always far away from the mosque, you'll recall.
Okay.
They make wuzu, by the time they walk and come to the Jamaat khana, the feet are dry.
Right.
The other thing is Middle Eastern countries are quite hot, and so the feet dry up.
Yeah.
Now, if you look at mosques in the South African context, the wuzu khana is always right next to Jamaat khana.
Correct. Yeah.
There's no time for the feet to dry.
Yeah.
And on top of that, some would wear certain kinds of socks, for example, nylon socks and so on, and that would promote the growth of fungus. It doesn't absorb well. So you need cotton kind of fabrics to absorb. And that was, we also made huge posters, and these posters were sent to all the mosques in the country, or many mosques, many received them, and they put them out in their notice boards, showing what fungal infection looked like. And if there's a need for that, we'll do it again. Actual photographs of the fungi, and what it looked like on the skin, and then how what to do if they had fungal infection.
Now, how does sweating and humidity contribute to the fungal infections?
The fungus thrives in that kind of environment. In other words, if you have a dry environment, the fungus is not able to multiply and is not able to grow.
Right.
But if you have a moist, warm environment, and if you look around you and you see where these fungi grow, it's always in moist environments. Even on the human body, for example, you'll see it in body folds.
Oh, okay.
Right?
Yeah.
And even in obesity, when you see more body folds, you'll see the fungus thriving in those areas because it's warm and moist. So warmth and moisture are the two necessary requirements for fungi.
So now, sharing of towels, often there used to be towels in the wuzu khana, and many people use those towels, and they're often very damp.
Yes.
Can that, and clothing as well, can that spread the infections?
Yeah, I think it's a very good idea that these days the mosques are now providing disposable paper towels.
Right.
I think it's more hygienic and that you're not going to be transferring infection. And of course, I'm pleased to say that very few musallis would pick up the towel and wipe their feet with it. They use something different for the feet, and maybe they would use the towels on the hands and so on.
Yeah.
It's more common to get fungal infection on the feet. The reason for that is we have shoes on the whole day. And the shoes would provide a warm and moist environment for the feet. The hands are open. You don't get fungal infection of the hands often. So when you wipe your hands and your face and so on, it's usually fine with a towel. But the most hygienic process, of course, is to have the disposable towels that people wash the face and hands with and feet and throw the towels away.
So you're saying it's very necessary after wudu to wipe your feet dry?
It is necessary to wipe the feet dry. Most mosques would provide the toweling now.
Right.
And so it's a good idea to wipe the feet dry, yes. Because if you leave it moist, for one thing, you're carrying the fungus into the mosque, right? In a wet environment, it spreads more easily.
Yeah.
And so wherever you put your footprints, you'll be depositing fungi in those areas.
All right.
And the other thing is, of course, the other side effect is you can slip and fall. So it's worthwhile drying your feet before walking on the slippery tiles.
Right. I mean,
And of course, it protects against fungal infection. It's not the only thing. I mean, you got to treat the fungus, of course.
right. Yeah.
And now my simple question though is, what simple hygiene habits can help prevent a fungal infection, especially after bathing and wudu? Because I know a lot of people have this inclination of that maybe if I spray vinegar before and after, it will get rid of it. Is that an old wives' tale, or does that have any merit?
No, well, we don't use there's an echo.
No, there's no echo. We can hear you loud and clear.
All right. The fungal infections are treated with medications. We don't usually put vinegar on the feet. We leave that for fish and chips. As it is, if you take your socks off after a hard day's work, it's already like a fish and chip shop.
Hey, Doc, you're right.
So what we would recommend is, of course, to get a diagnosis. And to get a diagnosis, we scrape the feet, the skin scales, and look at it under the microscope and make a diagnosis.
All right.
That's what a doctor would do. So if you see a doctor, he would scrape the skin and look under the microscope and make a diagnosis. If he doesn't have the facilities or a microscope in his office, he or she can take a scrape and send it to the laboratory and get a diagnosis.
Absolutely.
Now, once a diagnosis is made, there are certain antifungal medications that are available. For example, we can apply the antifungal medications, or we can take the medications orally. And that would depend on how severe the infection is. If it's mild and just on the surface, we would just apply medication on it.
Right.
And if it is severe, if it's extensive, if the nails are involved, if extensive feet are involved, if there's a large area of the body involved, then we would always use oral medication. And the doctor would then decide which one to give and which one to choose. There are 3 basic oral medications.
Right.
And one of them is given every day for 3 months if the nails are involved. One is given for 7 days in a month for 3 months. And one is given once a week until there's complete clearance. And the duration, of course, will depend on what we are treating.
Yeah. So now, does obesity and diabetes increase the risk of fungal infections?
Yes, both obesity and diabetes increase the risk of fungal infections. And the fungus that's usually seen in diabetes is Candida. So Candida is very common in diabetes. In fact, so common that if we see candidiasis in an individual, we almost routinely screen for diabetes.
Yeah.
That's how common it is.
How would you describe Candida? Apologies for.
No, that's fine. It's a fair question. Candida would depend on where on the body it is. If it is between the toes, the skin can become white in color and it looks wet.
Okay.
And it's not dry and scaly like we see in the other fungal infection, which we call Tinea Pedis, right? Or ringworm. Ringworm is a different fungus. Candida is a different fungus. So Candida would produce white maceration. In other words, where the skin rubs against each other, the skin always tears,
Yes.
right? We see that between the digits of the feet, and we see that between the digits of the hands as well. Okay? And we see it in the base of the nails, where you can get swelling of the base of the nails. And that we would see particularly in housewives and in nurses and in people who are doing wet work all the time, in domestic servants and so on, that are constantly immersing their hands in water. The detergent damages the cuticle, and then Candida organisms get into the skin fold, and it causes swelling. You don't have it, so don't worry.
Yeah, baby's checking.
He's checking, busy checking.
She's checking furiously, but I can confirm that she does not have it.
Doc would know.
Yeah, he would.
Now, Doc, you said that you did a test around all the mosques. I'm personally curious, what was the worst case that you've seen?
We've seen people with fungal infection between all the digits, including the entire sole of the feet. And all the nails involved. I mean, that's severe. You need nails for fine movement.
Yeah.
If it involves the fingers, then writing becomes a problem. If you have it on the feet, then of course jogging and running and so on becomes a problem. But those individuals can also have spread of fungal infection in other parts of the body, and sometimes it starts in the groins but goes down up to the knees because of the incorrect medication that is sometimes used, which we can talk about. I mean, patients who have very severe and extensive fungal infection are often using cortisone creams.
Okay.
And I would warn against the combination products which contain antifungal agents and cortisone creams.
Okay.
The reason for that is when you apply a cortisone cream, it takes the inflammation away. It takes the redness away. You don't see any redness on the skin. But it doesn't kill the fungus.
Okay.
So when we use this combination, the steroid would suppress the appearance of it, and you think it's better, so you stop. You haven't used it long enough to kill the fungus.
Oh, okay.
So
okay.
the medication is kept away, and after a few days, it starts again.
All right.
You reach for the same medicine and put it back.
Yeah.
You suppress the inflammation, but the fungus is not killed. So the fungus grows bigger and bigger and bigger and bigger, wider and wider, and it ends up involving large parts of the body. We've sseen them going across the entire chest or across the entire abdomen.
Jeez.
And very commonly, if it starts in the groins, it affects the whole abdomen and the knees, the inner thighs. So that's how it spreads. And this is why it's important to treat the fungal infection when we see it, so that it doesn't spread to all these areas. And it doesn't put the rest of the family at risk, and it doesn't put the patient at risk for other areas.
A message coming in from Meroon says, Salams, can I please have Doc's cell number? Well, you can give you his surgery number or room's number at Westfield Hospital.
Perfect.
We'll do that for you. Another one says, for him, can skin disorder cause lupus?
Lupus is an entirely different condition. So lupus is an autoimmune disease. In other words, the body attacks itself, and you can get a wide variety of skin ailments with lupus. In other words, it can cause damage to blood vessels, it can cause damage to the surface of the skin, it can cause redness, it can cause mouth ulcers, it can cause problems inside the mouth and nose. In fact, it affects any organ in the body.
Okay.
And even if we look at the criteria, about half a dozen of them relate to the skin. So lupus is diagnosed by a range of criteria. In other words, there needs to be about 14 criteria to diagnose lupus, and that includes skin signs, but it can affect the liver and the kidney and the any part of the body, the heart, the brain, absolutely any part of the
Everything.
body. But we do blood tests, and the blood tests, the physical signs, and the appearance of it will then determine whether it's lupus or not. Often we need a biopsy to make the diagnosis. In other words, we take a piece of skin, we send it to the laboratory, and the laboratory then confirms the diagnosis.
Mo says, Slums, guys, Doc killed us today.
He did.
It's a good show. Always wondered where fungal infections come from. Keep up the laughs, salams, and du'as. Ramadan is flying now on day 6. If you have any questions, we are in studio with Dr. Naufal Rabobee, specialist dermatologist. 060 904 1056. Keep it locked onto the afternoon jam right here on Radio Ansaar.